All right, this is probably the most important slide of everything that we talked about today with this topic, because essentially it involves, and I'll get into the details of each one of these things, but it involves that we have to make sure our diagnosis is correct before we go forward, right? And then once we have that diagnosis, inappropriate elimination, how do we treat it? So basically, this is what I'm going to be spending about. This will be in my practice environment, but then I'm going to be applying it to the shelter. Now, I'm going to tell you what I believe, but I would be very interested, you guys, if you have different ideas, I'm very interested in hearing what you have too. But this is what I've used in the organizations that I've worked with. Okay. All right. So the first is the behavior history. Now, this is kind of extensive here, guys, but it's a big, long list. But essentially what we want to be able to do is we want to have an understanding of the litter box habits. So with my clients, for example, I want to know how often are they scooping out the litter boxes? Where are they located? What kind of substrates are they using? Are they urinating on vertical surfaces or horizontal surfaces? Just multiple different things. So these are all the types of things that I like to take a look at. And in the practice environment, I like them to complete it prior to the behavior consultation, so it helps me prepare for it. So think about this, and how are we going to apply it in the shelter environment? So we'll get into that, like I said, a little bit later, but I'm interested in your feedback on it. All right, so medical problems. These are the minimum things we have to do, you guys. At a minimum, when we know a cat has been urinating outside the litter box or defecating outside the litter box, we have to have a physical exam. Now, I think all this morning it's been repeated how important that physical exam is. And that's something that only a veterinarian can do. We have to be able to determine the neuter status. As we know, you guys, is that if you have an unneutered dog or cat, their likelihood of marking or something like that is much greater. So we have to do that. And then doing the urinalysis via cystocentesis. Does everybody know what that is? That's where you're taking a needle into the bladder. You're able to draw the urine out sterilely. So that's why I always recommend we do a cystocentesis, because we get a much better results from that, or more accurate results. And then lastly is, plus or minus doing a urine culture, depends on what they find, or abdominal x-rays. But so just think about this, is physical exam, which I include in the determining neuter status, urinalysis. Those things are minimum. With defecation, it's a little bit different because we need to do a fecal exam. Okay, and then possibly expressing the anal sacs is something else we have to consider. All right. Now, there may be other tests that are warranted dependent upon the physical exam. Like, for example, if there's a concern about kidney disease, they might want to do a creatinine level. If they're worried about diabetes, they might want to do a blood glucose level. If they're worried about hyperthyroidism, they might want to do a thyroid level. So it all depends on the results of the physical exam. But we've got to have that first. And to determine neuter status, okay, the one on my right, or the right there, the left as you're looking at it, is an actual tattoo of a cat that's been spayed. Right. Sometimes when they don't, tattoos are pretty new. We've just started using them, especially these spay neurothons that I'm involved with once a month. We just started doing that in our events. But you could also shave and look for a spay scar, so of ways to determine if they've already been sterilized. And on the right is that you see the barbs up there. That's an unneutered cat. Are you guys familiar with that? The barbs on the penis of a cat. And then down here is a neutered cat. All right, so that's with, and obviously with cats too, is that you can actually see the testicles. But there are some cats that are called cryptorchids, which are the testicles haven't descended, but you could evaluate it by just looking at for barbs on the penis. So we've got to determine the neutered status, because if they aren't neutered yet, what do? We get them neutered. And that's a really pretty standard thing. And actually, studies have shown that 90% of male cats no longer mark after neutering, and 95% of female ones don't after spaying. So that's why it's such an important thing. Even when there's a physical diagnosis of a problem, you may have to also consider behavioral therapy. Because remember we talked about that, negative associations with the litter box, if you've had some pain associated with it. Oftentimes, we'll have to do that in addition, even after we resolve the medical issues. Okay, so, and I'm going to go through each one of these individually, you guys, but so I wanted you to have one slide where you can actually look at the different things you need to do. So remember, the two things that we try to do is we try to do attraction therapy, attracting the cats to the cats, and aversion therapy, keeping them away from the places that you don't want them to urinate defecate. So these are what I really consider environmental changes. All right, so let's do it individually. Scoop out daily. I mean, in my household, there was at one point that I had 5 indoor cats and 2 outdoor cats, and we were scooping twice a day. And now we're down to 3. We scoop out. We still scoop twice a day. This is the habit we've gotten into. And it's such an easy thing to do. It's just getting in the habit of doing it. So scooping every day is critical. And then you want to clean the litter boxes on a regular schedule. So say, for example, if you use clay litter, okay, you're going to want to probably at least once a week throw it out and get fresh stuff. If you're using scoopable, which is really preferred, and we'll get into that in a little bit here, we want to scoop once or twice a day, replenish the levels, but probably once a month, actually clean the litter box. Now, it's very important to remember, too, is that you just want to use like dishwashing soap. You don't want to use anything with ammonia, any ammonia products or anything like that, because the strong sense of ammonia cats will stay away from. So make sure you use just a mild dishwashing soap when you clean the litter boxes. All right, a variety of different boxes is what I'd recommend, too. I look at the litter boxes that are designed for cats, and I'm like, who came up with this? I mean, they're never big enough, right, guys? And so in my household, we don't even have regular litter boxes. What we have are the large plastic storage boxes. They're cheaper, There's one particular brand, it's called Iris, that's available at Shopko. It's the only place I've been able to find it in the Madison, Wisconsin area. And the reason I like it is it doesn't have any grooves on the bottom. So when you're scooping, you don't get all this litter going into it, So and they're bigger. I'm always amazed by the size of litter boxes. So I think, having a larger litter box. Now, I point out this one over here. This one is actually at my home. I have a cat that has cerebellar hypoplasia. Do you guys know what that is? It's when their cerebellum is a part of your brain that's responsible for balance, and so it didn't develop properly. He was probably exposed to panleukopenia when he was still in the womb. So when he walks like he's drunk. So his name is Eddie, but his nickname is Steady Eddie. And he has it pretty severely. But this cat gets along. He's definitely a crowd pleaser. But what we found when he was trying to get to the litter box is he would get into the litter box, but he couldn't turn himself back around. So what we did is that we cut this is the entrance, and then he's already facing that other way, so he could exit the other way. So here's the interesting thing about it. All my other cats like this too. They actually prefer it. So sometimes it's just a matter of being creative in the type of litter boxes that you provide. But I do think the most important point from this is a large one. And you can get varying heights and stuff like that, but you definitely want to provide a larger litter box. And some people say, well, I don't want to have that big thing, there. I'm like, well, if you'd rather have the cat peeing on your park carpet or something like that, that's fine. But I really think the larger litter boxes make a difference. Privacy. You want to place the litter boxes in a private, accessible location. All right? So that means not next to the noisy dishwasher or the furnace that goes off every so often. What you want to do is you want to have it in a private, accessible location, and you want to have one for every level of your house. And the standards, the recommendation, are one more litter box than the number of cats in your household. But those are basics. Now, there's always going to be exceptions, you guys. And you certainly don't have to provide the privacy as much like this one is demonstrating here. But it is important to have a private, accessible location. The other part is that, don't use covers or liners. And the reason for that is the covers, it tends to harbor the smells a lot more, right? And again, remember, their sense of smell is 40 times more acute than ours. And also, there's one exit point. So I look at something like this. Well, not only is there a cover on it, but let's go put a door in front of it, too. I mean, if we want to make it so the cats don't use things, well, this is the kind of stuff that we do. Or there's some litter boxes where they have to jump on top, and then they have to go down this little hole, and then I'm going, what are we? Well, anyway, I get frustrated with those things sometimes. But so what we want to do here is we want, again, and it has to be private, accessible, and this is, and it has to be something that's attractive from a smell standpoint and all of that. The liners, they tend, sometimes cats don't like the strong smell of plastic. Plus, they can actually get caught in their claws. So it's highly recommended not to use liners as well. Okay. And then as far as the type of litter that's concerned, highly recommended they're doing the clumping litter. Believe it or not, they've actually done studies on what cats' preference. Now remember, there's always exceptions. You may have a cat that prefers a different kind of litter. But what they actually prefer is clumping. I personally use something called Easy Clean by Pastel. They are not paying me to say this, okay? I've just used it for years, and I've actually recommended it to many clients, and they really do like it because you go with a low tracking formula because you don't want to have perfumes and deodorizers on them and things like that. They do make a formula that comes with baking soda, and I recommend staying away from that, just to go with the unscented, low tracking formula. And it clumps well enough, so it's really easy to clean, so you can get all the stuff out of it. It's something that I think the cats actually prefer. There's always exceptions. So one reason I bring this up is because oftentimes when I go into presentations like this, if I'm in the audience, someone will recommend clumping litter, but they won't give me something specific, So I always love to have at least recommended actual different types that you could use. And this is a personal favorite of mine. The other thing you might want to consider is just purchasing a new litter box. Well, if you're going to get some bigger ones, like the plastic storage boxes, well, you're going to be purchasing some new ones anyways. And they're like $5. And they're cheaper than the litter boxes they actually design for cats. And a lot of people, and I'm guilty of this too, where you've used the same litter box for years, right? And it's got even though you clean it, it's still got the very, very strong smell to it, okay? As a matter of fact, we've had the one that we designed for Steady Eddie. We've had that for a couple years now. Well, it's time that I actually need to, it just took more time to do that one, but we need to replace that. But I'm just guilty as everybody else. But sometimes just getting a new one. And like I said, if you use like a large plastic storage box, it's so much easier. Okay. Go ahead and move your food and water dishes from close to the litter box. I think Dr. Lister said that a minimum of 2 feet is what you want to have. And obviously in a home environment, you can even make it greater. As a matter of fact, in my household, the food and water isn't even close to where the litter boxes are. And the idea there is that most cats will not urinate and defecate where they eat and drink. So that's why you want to have it separate. Okay. And then you also want to have a variety of litter box depths. Obviously not this deep, okay? But what we have found is there's some cats that like just a little bit, and there's other cats that like are really deep because they can get in there and go ahead and dig around, and there's other cats that they want a little bit just because otherwise it's like quicksand. Okay, so it depends on the cat. So this is part of the investigative work to do, and that you could potentially help out your clients with that are considering about surrendering their cats. Okay, so now let's go to the other side. So probably the most important thing is the attraction therapy. Where I feel I've had my greatest success is helping people make their litter box more attractive to the cat. Is that attraction therapy? So that's if you because I know you have limited time and all that, but there's something that you have to choose to talk with your clients about, or When I say clients, I'm talking about people that are considering surrendering their pets to a shelter environment. That would be the part I would concentrate on. Well, number one, you have to have a urinalysis, you have to rule out medical issues. And number two would be the attraction therapy. So the other part is the aversion therapy. So what we do is we start out as we place some kind of deterrent to the site where they're going. Now, obviously, we have a much likelier success rate if they're going in one or two spots. It's tougher when it's all over the house. Not impossible, but it's tougher. So probably the one thing you'd like to do is when you're using aversion therapy, you don't want to be associated with the aversion, right? Sometimes that's tough to do. But what you can consider doing, the things I probably use most commonly, is something called SCAT. Have you guys heard of this? Where it's a motion detector, and then it sprays out compressed air. So if you can put it by a certain area that they're going to, and that way it's always there, and then we're not trying to hurt the pet. We're just trying to startle them. Okay, and the nice thing with the SCAT is that it's immediate, because it's really important when you're doing aversion therapy that you do it right away. Okay, that it or within 30 seconds of the actual behavior, and that's what that helps you do. What I have other clients do, which is a little, another avenue and something to consider, is just take the plastic rug runners and turn them upside down. So they've got the little pointy things there. Like, say, for example, the cat is urinating on the carpet in a particular spot or on a couch. You just take and it's real inexpensive. You can go to like a Home Depot or a Menards or something like that, and you can go ahead and cut the size that you need, and you place it where the issue is. Now, are there cats that will still go ahead and go on that plastic? Yes, there are. But in most cases, they won't go onto it because it's very uncomfortable for them. Okay. So we do something to make that area unattractive, so deterrence. Now, it's real important to use something that breaks down the urine. Doesn't just mask it. I'd really stay away from your typical household cleaners. You want to have something that's designed to break down urine and feces. So probably the most popular ones are Nature's Miracle, which a lot of people have. And that's an option, okay? Another one is anti-icky poo. Have you guys heard of that before? No? Anti-icky poo, right? It's another big one. And then my personal favorite is cat odor off. Now, I think you can only get that from veterinarians, but for me, it's really good. Again, it's a personal favorite. Doesn't mean that there aren't other ones that you could use. But with the cat odor off, it actually breaks down the urine. It's pretty good about and because like it's on the carpet, you have to let it soak into the carpet pad. So what's great about this is that you just put it on the carpet and then you just let it sit there. So it's important that you get what's underneath there too, underneath the carpet itself. For me, it's pretty good about removing the smell. It's not as good about removing the stain. So oftentimes I'll use something else to remove the stain. But that's a personal favorite. There's lots that are on the market. But the key is to make sure people are using something that is removing, is breaking down the urine so the cats aren't attracted to going back there over and over again. And then lastly, what we want to do is remove, if at all possible, is remove access to it. So like, for example, if a cat's going on a throw rug, remove the throw rug. I know that seems, like, gee, just do that. But and it doesn't mean it's necessarily forever. It just means for now, remove access. Now, you might have to block it, like if there was a particular area that they're going to, like, say, a child's room. They were only going to close the door. So while you're working on the behavior modification and the environmental changes, you would prevent access to it. All right. And then shaping the cat's behavior. This is important, you guys, but probably not as important as that attraction therapy that I talked to you about, at least in my experience. But what I have my clients do typically is I have them take the cat to the litter box frequently, a couple times a day, put them in the litter box, all right? And if they show any motion, like if they use the litter box, oh, great, they get lots of praise, or food treats or something like that. But if they even show emotion, like they start scratching in the litter box, that's a good kitty. That's a good kitty. But now, if this freaks the cat out, don't do it. There's some cats that it does, you know. But there's others that if you can be very gentle and calm and do this, it's a way of getting them to have, you know, positive associations with it. All right. You know, no physical punishment. I still can't believe this, but there's some people that take the cat's nose and put the nose in the urine. That they still think that's the right thing to do. So yeah, no kind of physical punishment. So or swatting or anything like that. It just doesn't work. Doesn't work. You can go ahead and temporarily put a litter box on the plate on the inappropriate urination site. The key is that if they start using that, but that's not where you want it because like it's in the middle of the dining room floor or something like that. You want to gradually, and when I talk about gradually, guys, I'm talking literally inches a day. Move that litter box to the place where you want it. What I find the biggest impact or the biggest mistake people make is when they try to do these things much too fast. You know, cats are very, very affected by their environment. They need things much, much slower. Okay, so if you do catch them in the act, I do something I call interrupt and redirect. Remember this because this is something that's used with dogs quite a bit too. So we interrupt that behavior in a way that causes them to abort it. So you might use like a squirt gun. Now the problem with that is that they're going to see that the squirt gun's coming from you. But you need some way of interrupting them. And then you redirect them by taking them to the litter box. Now, in my house, of course, on occasion, these things happen. It's just bound to when you have a multi-cat household. If you cannot be calm and relaxed when you catch the cat in the act of going outside the litter box, then it's better for you just to walk away from it. Because the last thing you want to do is like, you pick the cat up, over here, you scream and you put him down in the litter box. Are they going to have positive associations with the litter box? Because you guys, I'm just like you. I'm feeling the same thing. You know, but I have to tuck myself down, say, I interrupt it with a stern no or something like that, and I have to calmly take them to the litter box. But I have to force myself to do it because that's not what I'm feeling inside. Fortunately, it doesn't happen that often, but once in a while it does. Anyways, in a multi-cat household, you want to create an atmosphere of plenty. There's lots of litter boxes, right? And all kinds of different locations. There's plenty of food and water bowls, right? Lots of different toys. So there isn't competition for the resources in the home. Also, not only competition, but also attention. Make sure that each one of your cats are getting individual attention, too. So just create this atmosphere of plenty so that doesn't become an issue. And then we can do things like, and I don't usually go to this right away, but the use of like confining a cat to a smaller area. And that's actually an advantage that we have in shelters, and we'll talk about that in a little bit. And then gradually exposing them to more areas. But I usually reserve that because oftentimes the other environmental changes that we've done make the difference. But we can reserve and then gradually expose the cat to other areas. And keeping a behavior diary just essentially for letting us know if we're seeing improvement. So that would include the date, the time, if they used the box, if they didn't use the box, was it urine, was it defecation, was it urine or stool, and if it was out of the box, were there any kind of extraordinary like you had a lot of company or something like that. It's just helpful for us. Okay, so we've got a couple of behavior products that I've used in my practice. Are most of you familiar with Feel Away? Okay, it's a synthetic version of the facial pheromones that cats give off when they rub up against you. Okay, and essentially what that does is that when they're rubbing against you, they're marking your territory, number one. But it's something that they're feeling good. So what they've done is they've and it's been out there market for probably 10 years now, where they have a diffuser. The diffuser covers a 500 to 650 square foot area, and then also have a spray. So oftentimes I really like this product. I do some fostering in my household, and I think this really helps with my resident cats when I have foster animals. And I don't I always have the foster animals in a separate room I don't introduce them to my own cats. But anyway, so I find it very, very helpful. Now, oftentimes if I have a client, like, and this is used a lot for spraying, if there's a particular area where the cat's going on a horizontal surface, I'll actually combine doing the diffuser with the spray. And it has to be done every day at about 6 inches from the site. Right. The question is, do you put it on the surface where they're urinating? And that's correct, yes. So you clean the area, obviously, with an enzyme cleaner, and then you spray it with once a day with the Feline. Yes. The question is, what's the theory behind it? Is it primary calming? And that's the idea, is because with these facial pheromones, they elicit these things when they're feeling good. So there's a calming effect that comes with it. So the question is, does that mean that they go to the place where they were urinating inappropriately before, they're now calm, so they don't go ahead and do it again? And essentially, that's the principle behind it. So what happens particularly with urine marking or spraying, is that there's a stressor. They feel a need to go ahead and mark their territory. And so that's what they'll do, is they'll go ahead and so once they're feeling good about it, there's no need to mark it anymore. Question is, urine is marking, and not always is it marking, but it can be the inappropriate elimination. Could be they just don't like the litter box, so they're going someplace else. But what about stool? Is that marking too? It can be. Usually it's not. Usually it has something to do with the litter box. Not feeling, because if you think about this, defecating is quite a vulnerable position to be in. Okay? So it's usually related to the litter box itself and not marking. But it's pretty rare. It's pretty rare. Okay. And the other one was something called catatrack. And essentially what that is they've done studies that have shown that there's an additive as well as litter itself. My personal experience is it hasn't, I'm not as supportive of it as the Feline, just from my own personal experience. Doesn't mean that it doesn't work. It's just another option that you can use. Okay. All right. So behavioral pharmacology. Now, what I tell people, and this is really important, and is that it's not the first thing I grab for, but it's not the last thing either. I mean, I've had some clients that say, oh, well, yeah, I'll use medication as a last resort. So I don't want you to look at it like that. Look at it as an adjunct to therapy. Just like the environmental changes that we're doing, just like the behavior modification we're doing. It's an adjunct to therapy, not a replacement for it. So I really try to get people in that mindset because I don't want them to look at it as a last resort, because it really isn't. And then, like I said, usually it's more successful with motivated behaviors, like stressors and things like that, like urine marking. You have to remember there are no drugs that are approved to be used in this matter for cats. Okay, so what it is something called off-label, meaning that it hasn't been designed to be used with cats. But we are, and oftentimes in veterinary medicine, this is what we do. Because a lot of companies don't spend the money to do all the testing that this says, oh, well, you can use it for urine marking in cats or things like that. And then lastly is that there's the potential for human abuse. So we have to be careful about using that in our home environments. These are the doses that I typically use. Just to let you guys know, the most common one that I use is paroxetine, which is the generic version of Paxil. It's in the same drug class as Prozac. I use it probably, of all the medications for cats, that's probably the most common one I use. The other one I would probably use is like alprazolam, which is the generic version of Xanax. Those are probably the most common ones I use with cats in this situation. Just so you're aware of, I personally never use diazepam or Valium in cats. And the reason for that is because there was a study done, actually from someone I used to work for, Dr. Ilona Rodan, that oral diazepam in cats can cause hepatic failure. The other one I stay away from, you guys, just from a personal experience, is the buspirone, or Buspar. I used it in one of my own cats. This is back 13 years ago when we just started using anti-anxiety medication in cats. He was never aggressive towards my other cats, and all of a sudden, within a half an hour, he was aggressive towards them. So once you see that, you kind of stay away from those particular drugs. Just to remember, I would probably stay away for sure diazepam, but there's some veterinarians that still use it. and probably the busprone, which is, there's big studies done years ago on that with inappropriate elimination. But my personal favorite is paroxetine or Paxil.